Fibrosis is scarring. So it's the scarring that you do not see, but it's the scarring that you feel. Remember, liposuction, you have little incisions through the skin, but you're liposuctioning, you're dissecting, you're operating all underneath the skin, between the skin and the muscle to remove the fat. So everywhere there is a surgical field. So all around here, including the abdomen, is where the surgery occurs, even though you don't see it. So after the surgery, the tissues have to heal. During that time period, the tissues are hardened and you could feel it, and that's considered to be fibrosis. Now, fibrosis is scarring. Most of the time, it fades and resolves with time because all scars take about 6 months to a year to kind of fade and resolve completely. It's not something that will spread all over your body, and it's not something that will be life-threatening. If you had children, there's a more chance you'll feel hardened areas because you have extra tissue there. The child stretched you out, and so the skin is stretched, the tissue underneath the skin is stretched, and that tissue is not removed with liposuction, and so you'll feel that tissue. That doesn't mean it's fibrosis. It means there's an extra tissue, maybe a little bit of scarring. To get rid of all that, especially if you have loose skin, you will need a tummy tuck after liposuction. Remember, liposuction just removes the fat. It's a temporary measure. If you do have extra skin, the best result is with a tummy tuck. Sometimes I have patients come in and saying, oh, this is all hard, I feel it's fibrosis, and when I feel it, it's not fibrosis, it's their muscle. So it's the fat being removed before you felt the fat. The skin of the fat, it was soft. Liposuction removes the fat, so now you have the skin and the muscle. So you feel the hard areas, and that's your muscle, it's not fibrosis. Now, what can you do to decrease this scarring called fibrosis? The aftercare, I think, is important after liposuction. It's my opinion. Not every plastic surgeon feels that way, but I've done a lot of liposuction, and they see a difference when the patient has gone to aftercare right away versus they laid at home for a few days, let the fluid build up, they didn't try to massage it out, and then the fluid hardens and has hard areas, and it takes a long time for that to resolve. You should get massages. If you had liposuction, that'll help the massaging of the fluid, smooth the skin, make the skin kind of lay to the muscle without any space in between, and especially if you wear the compression garment. The compression garment compresses the skin, it doesn't let the fluid build up, and so everything's smoother. The more extensive and the more aggressive the liposuction you have, the more risk of feeling those hardened areas and having this fibrosis. So if you had children and you have extra skin, extra fat in the front, if you take out all the fat aggressively, you'll have just skin tightening up, and it shrinks, and you'll feel it, this kind of like scar-like thickening around. If somebody never had children, they have no stretch marks on the skin is smooth. If you do aggressive liposuction or just liposuction sometimes, you have shadows and you have a little bit of a scarring underneath the belly button, and that's something that I try to prevent, plastic surgeons try to prevent, but it's always a possibility after liposuction because healing is a little bit unpredictable. If somebody had already had children, they have stretch marks, the skin is stretched out, you should be very aggressive. You take out pretty much all the fat you can from the front to make them as flat as possible. So in summary, fibrosis after liposuction does occur. The more aggressive the liposuction, the more chance of fibrosis. The more children you had, the more your abdomen was stretched out, the more weight loss, let's say you lost beforehand, the more of this hardening you will feel, and all of that is normal. It doesn't spread all over your body, it just stays as scarring in the place where it is, and usually with time it shrinks. And if you get aftercare, massages, lymphatic compression garments, I think it helps to smooth everything out, and that's fibrosis.